A pleasant afternoon to all our participants, live viewers, to all our faculty, staff, and students of Carlos Hilado Memorial State University in all four campuses, namely Alihis, Binalbagan, Fortune Town, and Talisay. To formally start our virtual orientation, let us offer a moment of silence for the invocation to be followed by the singing of our Philippine national anthem.
A prayer for our earth. All-powerful God, you are present in the whole universe and in the smallest of your creatures. You embrace with your tenderness all that exists. Pour out upon us the power of your love that we may protect life and beauty. Fill us with peace that we may live as brothers and sisters, harming no one. O God of the poor, help us to rescue the abandoned and forgotten of this earth, so precious in your eyes. Bring healing to our lives that we may protect the world and not prey on it, that we may sow beauty, not pollution and destruction. Touch the hearts of those who look only for gain at the expense of the poor and the earth. Teach us to discover the worth of each thing, to be filled with awe and contemplation, to recognize that we are profoundly united with every creature as we journey towards your infinite light. We thank you for being with us each day. Encourage us, we pray, in our struggle for justice, love, and peace.
Once again, good afternoon, everyone. I am Mel Stephen Amakan, a staff from the Office for Student Affairs and Services, your host for this afternoon's orientation. So it is my pleasure to welcome you all to our virtual orientation on Republic Act 1122-3, or also known as the Universal Healthcare Act. Yes, you heard it right. This Republic Act 1122-3, or also known as Universal Healthcare Act, mandates that all Filipinos are guaranteed to equitable access to quality and affordable healthcare goods and services, and protected against financial risk. This orientation is spearheaded by the Office for Student Affairs and Services of Carlos Hilado Memorial State University in partnership with Philippine Health Insurance Corporation, or PhilHealth. At this juncture, to give us his opening remarks, let us all welcome our Vice President for Academic Affairs, Dr. J.B. Estrellas. Let's give him a virtual round of applause.
Thank you, Mr. Amakan, Ms. Rosalinda Estevilla, the Vice President for Administration and Finance, Dr. Janet P. Espinosa, the Director for the Student Affairs Office and Services, and of course to all other designees, faculty, staff, and especially to our dear students. First, I would like to extend a congratulatory note to all of you at the same time of greetings that I'm welcoming you all to Carlos Hilado Memorial State University. You heard it right. We are now officially a state university, and other activities are now on progress for us to really prepare at the same time to embrace this new typology of our institution. So be proud and be happy because especially for you, dear students, who will be graduating this coming uh, July, you will be graduates, the first graduates of our university. And at the same time, this afternoon, this is a very important activity that we are holding because we are also embarking to the opening of our classes this coming first semester of AY 2022-23. And we are going to hold or conduct the so-called limited face-to-face classes. And as you all know, last March 14, 2022, there was a meeting at Malacanang and the acting presidential spokesperson, Ablan, and I cited, he mentioned about the uh, Resolution 164 of the Interagency Task Force for the Management of Emerging Infectious Diseases, which requires medical insurance coverage for students returning to in-person classes. He said that HEIs shall ensure that students who will participate in the conduct of limited face-to-face classes are registered with PhilHealth or with equivalent medical insurance, which covers medical expenses related to COVID-19 as direct or indirect contributor. This is the portion of the resolution, which I do believe later on this will be properly related to you through the office of Doc Janet, Office of Student Affairs, relative to the RA 11223. And that is why it's very important that we listen and we are indeed moving towards the opening of our classes. And I'm happy to inform you that a good number of our students are actually already vaccinated as one of the requirements other than this healthcare. But again, I would like to encourage all of you, especially those who are really interested to go back to school physically. So please make sure that you are vaccinated because that is one of the requirements. You cannot do otherwise because that is mandated by the IATF. Only those who are fully vaccinated with insurance coverage will be allowed in the conduct of the limited face-to-face classes. So this is already in advance information. Nonetheless, I'm so grateful to see you here, even in this so-called live streaming. And please listen and actively participate if you have some queries or questions. Again, there are series still of ongoing meetings and dialogues relative to some IATF guidelines. In other words, this for the meantime, this is the requirement, and we are still be vigilant for whatever upcoming requirements that we need to comply so that we can go back to school and have our interaction with our classmates, with our teachers in the so-called limited face-to-face classes. Mayong hapon sa tanan, kag madamo nga salamat sa pagtambong nyo, especially for this seminar, webinar. We call it no webinar because we are in the web. Thank you and good afternoon, everyone. Stay safe.
Yes, thank you very much, Sir Jay, for that heartwarming message and for spending your time with us. At this point of time, let us have a little kamustahan with our participants. So when I call out your college, kindly comment down your name, program, and year level with hashtag Kamsu Excelsior. Let us start with the College of Arts and Sciences. Again, kindly comment down the name, program, and year level with hashtag Kamsu Excelsior. We have from our College of Arts and Sciences. We also have our participants from the College of Business, Management, and Accountancy. Let's move on from our students from the College of Computer Studies. Yes, how about our participants from the College of Criminal Justice? We also have our students from the College of Engineering. Yes, we have our students from the College of Education, from the College of Fisheries, and last but not the least, from the College of Industrial Technology. Again, comment down your name, your program, year level with hashtag Kamsu Excelsior. Yes, all right, there you have it. We are now represented by the 8 colleges of Carlos Hilado Memorial State University. Now, let me remind everyone to fill out the registration form that is posted in our comment section and in our caption. This will serve as your attendance for this afternoon's orientation together with the evaluation form, 2 evaluation forms to be posted later since this is a requirement for all our non-graduating students. Again, let me remind everyone that this orientation is a requirement to all our non-graduating students. Yes. Also, please do share this live video so it will reach all our students from across the island. And you may write your questions or queries regarding the orientation in the comment section. So later on, it will be addressed by our speaker during the open forum. Yes, I know all of you are excited and can't wait for our speaker to start her presentation. So without further ado, to give us an overview of this whole virtual orientation, its role in the conduct of the possible limited face-to-face classes, and to introduce our speaker for this afternoon, may I call on the Director for Student Affairs and Services, Janet P. Espinosa, PhD. Let's give her a big, warm round of applause, please.
Thank you very much, Mel. At the outset, allow me to acknowledge the following college official. We have our Vice President for Academic Affairs, Dr. J.B. Estrellas. We also have our Vice President for Administration and Finance, Mrs. Rosalinda S. Tuvilla. And of course, our resource person, or resource speaker later on, who will be properly introduced. And of course, to all our students coming from the 4 campuses of Carlos Hilado Memorial State University, good afternoon. Joint Memorandum Circular number 2021-004 provides the guidelines on the implementation of limited face-to-face classes for all programs of higher education institutions, or HEIs, in areas under alert level system for COVID-19 response. Section 1D of the memorandum provides that only students who are fully vaccinated located in areas under alert levels 1, 2, and 3 shall be allowed to join the limited face-to-face classes. Section 4H on medical insurance, the Joint Memorandum Circular provides that HEIs shall ensure that students who will participate in limited face-to-face classes under this circular and subsequent guidelines to be issued by the Commission on Higher Education are registered with PhilHealth, either as a direct or indirect contributor, meaning dependents of the direct contributor, or with equivalent medical insurance that covers medical expenses related to COVID-19. And in case of the violation of this provision, and it is shown that the student gets infected by COVID-19 brought about by his or her participation in the limited face-to-face classes, the HEI shall facilitate the necessary medical treatment or procedures for the affected students. It is for this reason why we are holding this afternoon's virtual orientation on the implementation of the Universal Health Care Program. With the signing of Republic Act 11223, known as the Universal Health Care Act, PhilHealth ensures that every Filipino citizen shall be automatically included in the National Healthcare Insurance Program. In preparation for the university's gradual reopening of classes, face-to-face actually, limited classes, let us welcome our resource speaker this afternoon. She is a graduate of the Bachelor of Science in Psychology from the Colegio de San Agustin, Bacolod, and currently enrolled in the Master in Public Administration program of KAMSU. Currently, she is designated as the point person on informal economy of the Philippine Health Insurance Corporation, Bacolod. To help us understand more on RA 11223 or the Universal Health Care Act, let us all give our virtual applause to Ms. Chid Andrea B. Malihan.
Good afternoon, everyone, and thank you so much for the warm introduction, Ma'am Janet Espinosa. Allow me, in behalf of the Philippine Health Insurance Corporation, allow me to thank and acknowledge Dr. J. Estrellas, Dr. Norberto Mangulabnan, all the administrators of different campuses of CAMSI, and the deans, professors, faculty, and staff, and of course, most especially, the students of 8 colleges and their parents. And of course, we'd like to take this opportunity to congratulate Carlos Hilado Memorial State University. Congratulations, Kamsi, for being elevated to a state university. And I am proud to be a student of KAMSU. Is that what we're called now? Anyway, to start, thank you so much for allowing us to give this orientation with the tagline, Alaga ng PhilHealth ang bawat negrenseng mag-aaral. So, can I be heard just fine? Okay, so welcome to our orientation on Universal Healthcare Program to the students of Carlos Hilado Memorial State University.
Yes, Miss Andrea. Good afternoon, Miss.
Is my presentation shown?
Not yet, Miss. Nadula siya actually. Ara na to siya kagina, nadula lang siya subong lang gid. And I don't know if na off imo mic or maybe I mean imo cam or is it because of the internet? Pwede mo lang siya, Miss, ma-reshare. Ano? You can see now your screen, Miss. I-full screen ta lang and then
Okay,
your
I
camera.
apologize for that, sir.
No problem, Miss.
One moment.
Yes, Miss.
There, do we have it?
Not yet, Miss. Wala siya na full screen. Pwede ba nyo ma-share, Miss, ang the one nga na full screen na. Sa pag-share na siya. Yes, you can see it now, Miss.
All right, so let's proceed.
Ang imo na lang camera,
For the
Miss.
university. Siguro ma-off lang ko, sir, para ma-minimize ang interruption
Okay,
if
sir.
it's okay.
Yes, Miss.
Sige,
Okay
thank
lang,
you so
Miss.
much.
Thank you, good. Proceed, Miss. Thank you.
So, universal healthcare, also referred to kalusugan pangkalahatan, it's actually a government mandate aiming to ensure that every Filipino shall receive affordable and quality health benefits. So this was signed last February 29 by President Rodrigo Duterte and was effective last November 2019. So we will discuss here three thrusts of the universal healthcare coverage. We'll start with population coverage. It's stated in Section 5 that every Filipino shall automatically be included into the National Health Insurance Program. So before, we have different categories. So under universal healthcare, we are simplifying the PhilHealth membership. So these are our categories before: formal economy for the employed, informal economy for the voluntary paying members, indigent, sponsored and lifetime members, and senior citizens. So now we only have two. We have direct contributors, those who have the capacity to pay premiums. Included here are the formal economy members, informal economy, and the indirect contributors, those whose premiums are subsidized by the national government, uh, like the indigent members, sponsored members, and senior citizens. So registration of students in the higher education institution into the National Health Insurance Program. So this is the joint memorandum circular from CHED and Department of Health, stating that students who prefer and are allowed to attend limited face-to-face classes under this joint memorandum circular and subsequent guidelines to be issued by CHED shall be registered by the health facility with PhilHealth or equivalent medical expenses related to COVID-19. So for Filipino students 20 years old and below, they shall be registered as dependent of their biological or foster parents and on their own are not required to contribute under the program. So for those who are 20 years old and below, we don't enroll them as members, but we add them as dependent of their parents. So the process for those na wala pa diri ka pa member and are planning to register with PhilHealth, we just have to accomplish the PhilHealth membership registration form undertaken by their parents and supporting documents. And attachment is only the birth certificate or baptismal, and it is to be submitted to the nearest PhilHealth office. Next is for Filipino students 21 years old and above. So they can be enrolled now as self-earning individual and on their own are expected to contribute to the program. Again, they just have to fill out the PMRF and attach the photocopy of school ID and their birth certificate and submit to the nearest PhilHealth office. And of course, they are expected to pay the premium of 300 pesos. That is their 1 month contribution upon membership. Now, for Filipino students that are qualified in the assessment of their family's financial capacity or those na-assessed by the medical social worker during their confinement, they are tagged as point of service financially incapable. So we have the form and the certificate of financial assessment from the medical social worker, and then registration will be through the POS system under the point of service or financially incapable. We also have the financially incapable. So they have to secure a certificate of financial assessment from their LGU social worker, and then they can submit it here together with their form and their attaching documents so that they can be enrolled as financially incapable and they don't have to pay their monthly contribution. So for those naman who are gainfully employed and are bound by an employer-employee relationship, uh, they just have to pass PMRF and properly accomplished ER2. So this form will be uh, from the employer to report them as their employees and be submitted here sa office. So just an important reminder, these guidelines are not applicable to students who are foreign nationals or citizens of other countries. Registration into the National Health Insurance Program of students who are not Filipinos, as well as their entitlement to National Health Insurance Program benefits, shall be in accordance with PhilHealth Circular number 2017-003 and all other existing pertinent policies. PhilHealth ID is being issued only to registered members based on existing policy, and the MDR, member data record of their biological or foster parents, shall serve as proof of dependent students that they are already included in the membership database. The MDR may be generated online through the PhilHealth member portal or requested with the nearest local health insurance office. Next, we have the service coverage. So every Filipino shall be granted immediate eligibility and access to preventive, promotive, curative, rehabilitative, and palliative care. So the current fill-up packages are the inpatient benefits. So these are for sickness or ailments that need confinement of not less than 24 hours, and outpatient benefits, day surgeries and treatment procedures done in accredited hospitals and other freestanding clinics that don't require confinement. So we have the case rates here of the common diseases that are usually availed. Dengue fever, 10,000. For severe dengue, we have 16. Pneumonia, 15,000. For pneumonia high risk, 32,000, and so on. This is a partial list only. For maternity, we have the cesarean section, 19,000. DNC, 11,000, and hysterectomy, 33,300. So of course, the members and their dependents are also entitled to Z benefits. These are life-threatening and costly diseases, covers primary disease conditions perceived as medically and economically catastrophic, and also other special benefits and emerging diseases, benefits in line with three Millennium Development Goals and emerging diseases. Examples are the maternity care package, outpatient HIV/AIDS treatment, Ebola, MERS-CoV, and Zika. So these are our Z benefits and their coverage. And these are the contracted facilities in Western Visayas. So for maternity care package for hospitals, the coverage is 6,500. Non-hospitals like Well Family and Lying-ins, we have 8,000. For normal spontaneous delivery, uh, we have 5,000 for hospitals and 6,500 for non-hospital. We also have antenatal care package, which is 1,500, and the newborn care package of 1,750. So these are also other special benefit packages. TB treatment through DOTS, through our City Health Office, 4,000. OPB malaria package, 600. Outpatient HIV or AIDS treatment, 30,000, and animal bite treatment package of 3,000 pesos. So let's just go through this. So we have the fill out benefits for COVID-19. So this is the coverage. If the patient has mild pneumonia, the coverage will be 43,997, and as follows. So PhilHealth also covers the RT-PCR to our accredited healthcare facilities. We also have community isolation package for COVID-19 and home isolation benefit package. So within 2 years from the effectivity, PhilHealth shall implement a comprehensive outpatient benefit, including outpatient drug benefit and emergency services. So this is still on progress. We will have the PhilHealth Consulta and inclusion of laboratory procedures and other medicines. So for our financial coverage, we have the population-based health services. It refers to interventions which have population groups as recipient. So these are indigent members or sponsored members financed by the national government through the DOH and provided free of charge at point of service. For individual-based health services, this refers to services which can be accessed within a health facility or that can be definitively traced back to one recipient. So it shall be financed through prepayments such as PhilHealth, private health insurance, and other HMO plans. So to summarize, universal healthcare is all about population coverage, the automatic inclusion of every Filipino citizen in healthcare programs, universal program survey coverage, eligibility. Before we have to have 9 months contribution prior our confinement, but now we can avail immediately and have access to comprehensive outpatient and inpatient benefits and provision of primary care provider and financial coverage, zero co-payment, fixed and predictable co-payment. So these are our contact numbers. Feel free to reach us through our numbers or you can go here at the local health insurance office Bacolod. And of course, we also have an office, Robinson's third floor, our PhilHealth Express. You can go there. They offer membership services. You can also access the PhilHealth member portal. So you can enroll at www.philhealth.gov.ph. You can print here your MDRs and have access to your contributions. You just need active email address and your PhilHealth number for this one. You can also search if ever you need for admission. You can also search how much is the coverage for a certain diagnosis. And for those na hindi pa Android users, you can access our website. That's it. It's updated for questions and clarifications. Sir Mel?
Yes. Okay. Thank you very much, Miss Andrea Malihan, for sharing your ideas and enlightening us on the Republic Act 1122-3 or the Universal Healthcare Act. Yes, at this point of time, let us move on to our open forum session. And in this time, we will be asking our students if they have questions or queries regarding to the presentation of Miss Andrea. You may comment it down so that it will be addressed by our speaker. If you have any clarification or is there something bothering you with regards to the Universal Healthcare Act, you may comment it sa aton nga Facebook Live so that it will be addressed. It will be addressed by our speaker. So if I may ask also our Director for Student Affairs and Services to be with us because maybe some of the questions here would be addressed to the school. Because I saw a question here, Ma'am Janet. Yes, you're around, Ma'am. I'll add you to the stream.
Yes, please.
Okay. So there's a question here. If required gid man bala ang PhilHealth or magka-PhilHealth ano ba? Yes, this is I've seen some question, same question actually. Kung required gid bala ang magka-PhilHealth sa CAMC, especially for the upcoming school year or academic year.
Okay, I can answer that. If they want to participate in our limited face-to-face classes, they should be in an insurance that provides provision for COVID-19. So it's either PhilHealth or other insurance. Pero dapat may insurance gid sila. Okay? Sige.
Okay, ma'am. Thank you very much. Let's see if may ara pagid kita diri. Actually, there is a question here. A message from a mayor from BSHM2C. Maas ko tani, what if binaka-registered ka na kag nadula imo PhilHealth ID? Pwede pa na makpa-register liwat? Miss Andrea, I guess this question is for you. If nadula, kung
No,
miss
you
or
don't need
naka-register na
to
siya kag
be
nadula iya PhilHealth ID. Yes, miss.
You don't need to be registered again since we have the record in our system. All you have to do is request for your PhilHealth record. You just have to bring one valid ID and one by one picture for your PhilHealth ID. So there's no need
Yes,
to
okay.
apply again
Register
since you
liwat.
are only given one PhilHealth number.
Yes, thank you very much. Yeah, Miss Andrea, I hope Miss Esparagosa na answeran ang imo question with regards to the concern. There's a question here. I don't know if it will be related, but what if kuno wala ka pa vaccine, ma'am? I guess this question is for
I
Ma'am
think
Janet.
mhm.
Yes, Miss Andre, do you have? Something to say po.
Ay, sa kay Ma'am Janet siguro, kay iya ka school,
Ma'am
is
Janet,
hindi siya.
Ano siya, Mel? Wala siya kapag-vaccine.
wala siya kuno ka pa vaccine, ma'am.
Only the memorandum circular, explicitly provides that only vaccinated students will be allowed to join the face-to-face classes. That answers his question.
Okay, thank you. Thank you very much. We have another question here from Maria Hana Luisa Tinaan. As a part-time worker, paano mabalaan if ginahulugan ka employer imo PhilHealth membership?
Okay, so you can access through our online services. If you registered your contribution, you can check there if narimitan ka sa imo employer, or you can just go here and have it checked at our collection section.
Okay, yes, thank you very much. I hope Miss Maria na clear ang imo nga concern. We have another question here, Miss. Let me find it. Kita ko to siya kagina. Do we have kuno an age limit kung magkuha sang PhilHealth or mag-register sa PhilHealth?
As what I've discussed earlier, only those who are 21 years old and above are enrolled as voluntary members. But for those special cases, no, like those who are already working, so minsan wala pa sila ka 21, pwede gid sila ka-enroll since it's mandatory to have PhilHealth benefits if you are already working. In other cases, there are some students who doesn't have parents anymore, or who doesn't have someone who can add them as dependents. So they are required to enroll sa PhilHealth as members. As also mentioned earlier, if wala pa means na makabayad sa ila contribution, they can go to their LGUs and ask for a certificate of financial assessment and then bring it here, so they won't be required to pay, but they will have PhilHealth coverage as sponsored for this year.
Okay, so thank you very much, Miss. We have another question here from Miss Rox Sian. What if nakaregister na pero wala kabayad since nag-resign? Need pa na mag-process liwat?
Number 5026. Please proceed to counter.
So mag-process ka uh, to change your category to voluntary paying member na lang if may means to pay, or again go to LGU and have your certificate of financial assessment. You just need to continue the contribution.
Yes.
Same
So
number lang.
continue na lang, makuha lang siya gyapon mi sa LGU sa certification to.
Pwede siya,
As
sir.
mentioned.
Yes, if amo na mapa-assess to sila if financially capable sila or not.
Yes, Miss. We have another question. What if kuno miss ang iya classmate may kung wala valid ID, is there any other alternative nga pwede magamit mag-apply for PhilHealth?
Valid ID. For applying, sir, our requirement gid siya is birth certificate.
Mm,
So we don't require valid ID.
valid ID. Okay, so again to sa
Birth certificate
question,
or baptismal siya.
birth certificate
Yung
or
birth na lang, if wala gid, pwede siya ka police clearance or voter certification if registered voter siya. We consider that also.
yes, to recall it, miss, para mabatian nila tanan, a requirement lang to get or to register for the PhilHealth is the birth certificate, a baptismal or police clearance, and the other one, the last one, gani miss? Sorry.
Voter certification
Voter
for any number
certificate.
ila, sir.
Yes, yes, and we have another question here. If under na sa PhilHealth ang parents kuno miss, makuha ka pa imo own PhilHealth ID or maparegister ka pa?
No, if you are aging 20 years old below, no need na magpa-member anay. Pag turn 21 mo na, that's the time na magpa-member ka. And sir, Mel, insert ko lang gali, no? Our registration form can be downloaded sa aton website. So before sila mag-proceed, may dala na lang sila na fill out ng registration form.
Yes, Miss. Thank you very much. We have another question here from Miss Natasha Miraflor. I get damo it concerns aton students. Okay pa mo with the concerns? Yes, hello, good afternoon. Once magtapa ka 21 years old, hindi ka na under sa parents mo nga PhilHealth, kag need na magkuha sang own mo nga PhilHealth. I guess it's a confirmation ni Goro, Miss, from ano, need na kung once makatapak na siya 21 years old, Miss, hindi na siya maging ma-under sa parents nga nga PhilHealth.
Oo, hindi
Hindi na
na. So,
mag-work
dapat
from home.
mapa-member na sila as voluntary paying members.
Yes.
For students from Binibagan campus, katansak sila sa Kababalan campus.
Okay. And also, Sir Mel, for students from the Binalbagan campus, they can transact sa aton Leo Kabakalan if it's more convenient for them.
Can you repeat that again, Miss? Sorry, kinag-catcha
Ay,
maybe
sorry,
because of the signal.
intermittent ang connection. For our students sa Kamsi Binalbagan, they can transact sa Leo Kabangkalan since it's near to them.
Ah, yes, Miss. Okay. Thank you very much. Let's see if may pa question. I guess we have the same questions, man.
See here, no, Sir Mel, ga-ask
Yes,
sila
ma'am.
kung may expiry ang PhilHealth ID. So, wala na siya expiry ang PhilHealth ID. Except lang if your ID is sponsored. So, before may availability on. But right now, ang aton ID nga bag-o with birthday and address, wala na siya expiry.
Yes, yes. Thank you very much, Miss. There's a question here kung how long kuno kung mag-process kita sa aton nga PhilHealth ID. Does it take days, on hours, weeks?
Actually, dasig lang gid siya, but it depending no sa number of clients man diri sa office. But we have a lane man for requesting IDs lang and MDR. So, guro pagsulod yun sa office, ma-wait siya. Like, the most na is 30 minutes and then makuha yung ID niya after 1 minute or 2 minutes. So,
Yes,
as
yes.
long
Thank
as
you.
complete yung requirements. So, remind na lang kami for our members na if magpa-transact sila diri sa office and if they are unable to provide authorization letter for the transacting person. So, para ma-provide na kitang ilang needs immediately.
Yes, actually personal experience sige lang gid man among to process. Nag-process kami at Robinson's Place, Bacolod. Yes, I guess the next question will be directed to Ma'am Janet. Ma'am, as to the full vaccination nga definition kun ma'am, does it need kuno ma'am ang booster shot? Or how do we define ma'am the full
Okay.
vaccination?
Thank you, Mel. Actually, the same says that only fully vaccinated students shall be allowed in the limited phase or to join the limited face-to-face classes. Now, I'd like all students to listen to the definition of the memorandum circular on fully vaccinated students. Fully vaccinated individual refers to someone, listen very carefully, who is at least 2 weeks past having received the second dose of a two-dose vaccine or the first dose of a single-dose vaccine. So meaning 2 weeks after sang inyo nga second dose sang two-dose nga vaccine, kag 2 weeks man after sang first dose of a single-dose vaccine. Or someone who received the recommended booster dose at least 2 weeks after. So, pwede lang ang fully vaccinated, but silingon, pwede ka lang ka 2 weeks after sang imo second dose sang 2 dose nga vaccine, kag 2 weeks after sang first dose nga vaccine, or 2 weeks after sang recommended booster dose. I think that's very clear. Mel, thank you.
Yes, thank you very much, Miss. We have another question actually, napangita na namon. Yes, good day. Kamsu, as what I have shown with Miss Malihan, presented about benefits of PhilHealth. The monthly contribution is 300 per month. When you pay for almost 4 years, it's 14,400. Ang ma-benefits is around 11,000 sa mga coverage. My question is, diin makadto ang sobra nga 3,400, does it go to the service or profit of the government? Naging sumahan niya git na Miss Andrea.
Again, no, Philippine Health Insurance. So we are an our premiums, ma-admit man ta or hindi, since we don't know when ta na siya kinahanglan. Just like paying bala sa imo car insurance, pay ka insurance mo, misan kabalo ka bala nga makabunggo ka or hindi. So that's the same thing man sa ato, no? Why we are paying for our health insurance. Kag dapat sige-sige na aton payment hasta mag 60 years old kita, or if unable na kita to pay, may assessment kita from the LGUs. So our contribution is also used for, since PhilHealth is for social solidarity, we are where the rich subsidizes the poor, or the healthy helps the sick. So that's how it works, no? So for those nga healthy, again, we are very lucky that we are not using our insurance, but we are luckier since we are able to help others. So the contribution, no, is also used to subsidize the sponsored and our senior citizens, because before hindi tanan nga senior pwede ka libre PhilHealth, but it was mandated that all senior citizens, since wala naman sila go work and some are wala pensions, kag wala na be children nga pwede ka dependent sa ila, so amo na may libre gid sila nga PhilHealth. So it's actually helping man our fellow Filipinos.
Yes, okay. Thank you very much. Yes. At this moment, Miss, we have our Vice President for Administration and Finance to be, she has actually an additional input with regards to the question. May I call on our Vice President for Administration and Finance, Mrs. Rosalinda Tevilla. Good afternoon, ma'am.
Good
Good
afternoon,
afternoon.
Rose.
Afternoon, Susan. I'd just like to add to Blacagina's question on the medical insurance that you have to be registered with PhilHealth. My question, di ko hindi be PhilHealth. Pwede man, but dapat nga medical insurance should cover medical expenses related to COVID-19. Makita tato kagina sa ginpakita ni Miss Malihan nga ang coverage sang PhilHealth dako kayo no sa pneumonia, may ara nga critical, etc. So amo na ang aton gid nga ginapangita tani nga coverage. So kung ang imo nga medical insurance is not PhilHealth, as long as ang imo nga medical insurance covers expenses related to COVID-19, pwede gid. As to ginambal ni Ma'am Jeanette, okay gito ang definition sang kung sino ang fully vaccinated. Kay only those fully vaccinated can participate in the limited face-to-face classes, which we will be conducting by August of 2022. Now, ang pamangkot gid laban, ang nila, why pa sila na vaccine, wala pa sila nakakuha sang ila maskin first dose. Well, sa kalawig na sang panawagan sang aton nga eskwelahan kag sang DOH, dapat by this time, if you're interested to participate in the limited face-to-face, dapat inject ka na. In fact, nag-on-site vaccination kita diri sa eskwelahan para makiter ka mo. But still, kung wala gihapon, watch out sa mga announcements nga gina-post naman sa Facebook ag sa mga chat groups on the schedule as far as Talisay City is concerned, sang mga schedule sang first dose, second dose o kon booster sang DOH. So I hope nga ang madamo nga wala pa dira nakapa-vaccine, please go out of your way and have yourselves vaccinated for your own good and for you to be able to participate in the limited face-to-face. Di ka mo gusto makita mga classmates niyo kag ang eskwelahan nga subong university na, so pa-vaccine na kamo. Thank you.
Yes, thank you very much, Ma'am Rose, for that additional input. Actually, ma'am, there's a question here. Since our student daw is paying for the insurance fee every first semester, is it considered na ma'am para maka-apply sila for the face-to-face classes since gabayad sila for the insurance fee, and that insurance kuno nga company ga-cover man siya sang COVID-19? How do we that, ma'am? Ma'am Janet?
Yeah.
Or Ma'am
Kung ang
Rose?
imo
Yes.
nga medical insurance covers expenses for COVID-19, pwede na na.
Yes.
I'd like to add
Ma'am
lang, Sir Mel and
yes, Miss
Ma'am
Andrea.
Rosalinda, no? I think minsan may ara ka private insurance, the hospital still requires PhilHealth since they deducting the coverage of their HMOs, private HMOs.
Mas manami gid siya
Kaya
kung
ginapauna nila
PhilHealth
deduct ang PhilHealth and then
registered
ang
ka kay
remaining
mas
amo na
dako
siya
ang
ang ila na
coverage.
bayaran.
So anyway, ay man balayran kung 20 years old below ka, di ba lang?
And
So ang
requirement man
imo,
sang
all you have
private
to do is
HMO
have
to
yourselves
have
registered
PhilHealth.
lang.
Yes, yes, Miss Andrea, sorry kay nag-cut. Medyo choppy lang ikaw. You have the additional input, Miss? I guess none. Yes, as mentioned by Miss Andrea Malihan Gani, although some of our students are paying for the insurance mandiri sa school, but most of the hospitals are requiring yapon sang PhilHealth. Gusto ko lang i-clarify mo statement kay Gina, Miss. If correct me if I'm wrong. Regardless kung may ara sila may ginabayaran nga insurance, private insurance company, still ang hospital ga require yapon sang PhilHealth. Kaya di sila ga-deduct. Correct, Miss? Medyo nag-choppy lang siya kagina.
Yes, required gid gyapon gina-require sang hospitals or HMO mismo nga may PhilHealth gid ang members. Kay amo na ila ginauna deduct ang PhilHealth deduction before sa coverage.
Okay, thank you very much, Miss Anne. The question here is just the same. To recall lang gani, if ang ID mo nadula, makadto ka lang sa LGU to get makadto ka lang balik sa PhilHealth office, Miss, no, to process your ID. And if
Yes.
sa mga nag-work before, kag nag-resign, sa mga indigenous people, Miss, they just need to go to the LGU to get for the certificate, the certification, hindi sila for the financial assistance as you mentioned earlier, and na muna siya i-present sa aton nga PhilHealth office. Same man sa mga
Certificate of
wala na nakabayad sila contribution sa PhilHealth. Okay, para ma-address na lang ila concern since most of our students same ila question same lang man ang sabat sina and answer na kagina. I just need to recall it kay para balay to clarify gid and ma-address man ang ilang concern. Yes, okay. Let us check if do we have any other different concerns from our students. Here we have question here, Miss. Miss, if unemployed ka na, need magpa-change from principal member to dependent?
You can have that option if wala ka pa nag-21. Pwede kagid ka pa deactivate sang imo PhilHealth and pabalik add sa imo parents if wala ka pa nag-21. But if 21 ka na, you need to continue it as voluntary paying member or if unable kita, mabalik kita sa LGU to have certificate of financial assessment.
Okay, thank you, thank you. Again ha, sa mga unemployed natin, if you wala pa ka-reach sang 21 years old, pwede pa ka pa-change. But if 21 and above na, ma-continue lang with the payment. Yes, do we have any other concerns? I guess same lang
I
man siya
think,
tanan,
Sir
ma'am.
Mel,
Yes. Yes po.
may question kita diri na kung below 21 ka, under ka sa parents mo, ano na, but silingon, magsulod sa school, ila PhilHealth ID ka parents amon ipakita. I think no gina-require sila yung mag-pass MDR na daan sa school before para ka face-to-face classes sila. Sa diin sila ma-pass, Sir Mel, para aware ang
Yes,
aton nga members.
maybe we can have Ma'am Janet to answer the question, Miss, or Ma'am Rose. As to the concern ko naman kung dependent ang kabataan sa sila parents, diyan sila mag-submit sa ID or ang ID pala sa parents ang i-submit.
MDR.
Yes. Go, Ma'am Janet.
Guro ano ta guro Ma'am Rose, activate ta guro ang sa guardhouse no nga every time nga magsulod sila, pwede gid nila ipakita ang MDR nila kung if they are dependents. Siyempre kung ano sila kung kung sila gid ang principal nga registered as principal, may ID gid na sila, hindi bala? Oo.
Yes,
Am I
yes.
right, Ma'am Rose? Okay na siya.
Hindi na pwedeng nga do may number lang sila sang
No, abi man.
MDR sa ilang parents. Kasi do hindi na yan budlay nga every time ang sulod sila
pwede.
pakita lang papel nga MDR no do ka ano no do ka hassle man.
Or they can
Perhaps
have man, ma'am, the
Sure.
MDR picturean or screenshot.
Picture lang, ma'am, sa
na
ano?
screenshot na lang guro.
Screenshot.
Para nga hindi na dugay-dugay isang papel pakita or ano na siya eh. It will take time. Oo, thank you for that suggestion.
Anyway, Mel, the crisis committee, actually, this is just one of the initial activities. More orientation will be given to our students and their parents relative to that. Thank you.
Yeah. Yes, this is just the first orientation that i-conduct sa atong students. More orientation pagid to all of our students. Bala, if I know all of you, kada mo gid sang concerns, sang question, kada mo gid sang gusto i-clarify. This is just the first orientation you can conduct sa school. More to come pagid, and we can still address the concerns later on. We're still on the process pagid man to like finalize everything with regards to the limited face-to-face classes. Yes, again, to recall lang, sa mention ni Ma'am Rose and the recommendation of Miss Andrea to all our students who are dependent to their parents, have a screenshot lang. There's a possibility nga screenshot lang sang ID sang inyong nga parents amo na i-present sa aton nga school. Every time
I
yung
think,
magsulod.
sorry, Sir Mel. Hindi guro ID, ang MDR.
MDR.
Siguro.
MDR. Yes, thank you for that, Miss. It's MDR pala. Yeah, it's MDR. Okay, thank you very much, Miss Andrea. And let's see if we have more questions here. The same lang man actually mo. They're asking if kulang ko no requirements, hindi bala ko no ma-qualify for face-to-face. Of course, that's why guro nga ginahatag ko gitawag siya as requirement because it is required. Hindi man na siya consider as requirement kung hindi siya required sa school.
Naging requirement, ang naging requirement is that you should be fully vaccinated and that registered ka sa PhilHealth either as dependent o kon member gid. Sana
Yes,
siya mga requirements gid importante.
Yes, yun So to all students who are
Miss
asking
Malihan.
with regards, yes, Ma'am Janet.
For example, Abi, nag-21 sila, tapos student pa sila, nag-register sila sa PhilHealth, do they need to pay before sila maka-avail?
Yes, Miss Andrea.
I think, ma'am, the question is if 21 sila maskwela pa lang, do they need to pay? Kiga katingin and out biya akong signal. Is that it, ma'am?
Ang point bala,
Yes.
kung for example, 21 pa sila, kagana pa sila sa school, enrolled pa sila, kay mga 21, mga third year pa lang may grades 11 and 12 na sila. Do they need to pay sa PhilHealth sang monthly before sila maka-avail, for example, sang coverage
Kaya
ng mga...
dependent naman sila.
Oo, kay independent naman
Okay,
sila.
hindi na sila, they are required to pay, ma'am, if hindi na sila dependent sa ila parents, like 21 na, kay until 20 lang gid ang qualified dependent sang aton nga members. Pag 21 nila, required sila to have their own PhilHealth. But if wala sila yung means to pay the monthly contribution,
That's right.
for under universal healthcare, gingaan kita sang option nga makuha kita certificate of financial assessment sa aton LGU, and then they can financially keep. If not, makadto sila sa PhilHealth, bring ang registration form, they will be registered as members, but they will be required to pay since sponsor ina sang national government ta. So muna
So, may more or less,
paid
do
na
may-
ilaya.
So certificate
Yes,
from
ma'am.
the LGU or certificate of indigency man na siya panawag.
I think
Okay.
ang indigency kuhaon ani sa barangay, and then
Barangay.
ma-proceed sila sa ila LGUs para kakuha sang certificate of financial assessment sa PSWDO, DSSD or MSWD. Basta sa ila LGU, ma'am.
So 300 per month na siya, no, Miss Malihan?
Yes, 300 per month aton premium subo.
Okay.
Yes, Miss Andre, as to the 300 per month, Miss, may question ang sa chat group para sa mga class mayors. They're paying 300 pesos hasta when siya mag-pay 300 pesos or as a mean trust Miss nga member siya, do they need to pay it monthly or may limit na siya nga good for a year? Uh, as to the concern is ano na siya ang aton nga response sa aton students. Miss Andrea, can you hear me po?
So for payment, they are required to pay monthly nga 300 hasta mag 60 years old sila.
Yes, Miss, go on.
Okay na. They're required to pay 300 pesos na monthly contribution until mag 60 years old na sila. If wala na sila capabilities mag-pay, pwede gid sila ka-stop as long as makakuha sila financial assessment from the LGU. Or if sa ulihi, pag married na sila, they can stop man if ang ilang spouse is also a member of PhilHealth para isa na lang ang gabayad sa isa ka household.
Okay. Thank you very much, Miss. As to the
But
yes po. Go, Miss.
at ang ila number is ara lang gina siya gyapon sa system, and if ever ma-employ naman sila, amo lang
Pwede na
gyapon nga
sila
number
appeal.
ang need nga gamiton and bayadan. Si
Yes, Miss. As
employer
to
naman
the
na ang ma-pay dayon.
yes, Miss. I have a question as to the certificate of financial assessment, wala, Miss, from the LGU. Once they have that, Miss, must stop sila pay or is it the LGU who will pay for them, Miss? Or must stop lang gid ila payment, on hold lang until makapangita sila sang work liwat and ma-resume ang
Oo.
ilang bayad.
Bali, kung may financial assessment sila, sir, dalon din nila sa office. So, their category will be amended and mo na ma-sponsoran ila PhilHealth. So, I think the validity is for a year. If next year, may employer na sila, employer naman na ang mabayad. If wala pa, they can be assessed again by the LGU, the DSWD office.
Yes, okay. At least amo ni siya actually ang doga nag-ano ginang concern sa aton nga students because they are asking na yes, 21 na sila, they need to register for PhilHealth, and how about kay wala sila work, they cannot really pay for the monthly gid nga fee. So it means they just need to go to the LGU to get for financial assessment, and if ma-qualify sila, they will be provided by the LGU for 1 year until maka-work sila. But if hindi pa sila ka-work, they can still have another assessment, financial assessment from the LGU to get another year, Miss, nga sponsoran sila sa government. Am I right?
Yes, that's
Yes.
the best thing with universal health care, no? Kay tanan has access gid siya for membership sa PhilHealth, makapay ka man or hindi.
Yes, actually, so it means, Miss, hindi kailangan mag-worry sa aton yung mga kabataan if they don't have the capacity to pay for the 300 pesos nga monthly, since our government is having this financial assessment that could provide their monthly nga fee of which is 300 pesos. So every year, they just need to get a financial assessment from the LGU, amo na i-present sa aton nga office. And how about those, Miss, ang ma-pay, diin sila pwede ka pay, ano ang mode of payment nga pwede la gamiton?
Very good question, Sir Mel. For our voluntary paying members, pwede sila kapa-activate diri sa office for online payment. So they can pay na through GCash. And if wala pa sila kapa-activate sang online payment nila, pwede sila ka-pay sa bayad centers, Western Union, LBC, Save More, SM,
We
or
have our
diri man
bayad
sa office,
centers.
pwede man.
Yes, yes. Okay. Thank you very much. One last concern siguro, Miss. This is for Ma'am Janet and Ma'am Rose. Our student is asking, kay since our student is paying kuno for the insurance fee, if they have the PhilHealth, ma'am, do they need still to pay for the insurance fee nga ginabayaran ta every start of the semester or the school year?
Actually, ang atong insurance is good for a year. Once they pay
Yes,
that sa
ma'am.
June until March na siya. And then, ang question niya is kung may PhilHealth na siya, ano to, Mel? Gusto
Kailangan
niya
niya pa bala kung magbayad sa aton nga insurance nga
na
diri sa school.
insurance. Depende sa estudyante. Kay kung syempre kung may insurance pagid siya aside from PhilHealth, mas may maka-avail pagid siya sa mga benefits. Pero siguraduhon niya gid ang insurance nga paon niya may COVID provision. May
Yes.
provisions ng COVID-19. Oo, wala gid na problema kay ang PhilHealth is more or less daw amo na siya yung backbone mo, base na siya. So kung gusto mo pagid nag-additional, wala gid problema. Pero siguraduhon mo lang na kung nga may COVID gid siya nga coverage.
Yes. Thank you, Gid. Thank you very much.
And we are
Yes.
encouraging everyone to register gid with the PhilHealth. So I think I saw one question kanina na the proof that they have to present to us once they will join the face-to-face classes is pwede lang na ang screenshots ng MDR kung dependent sila, ang screenshot man sang ilang vaccination card. Ang siran ko na lang pagit ng isa ka question kagina, kung first dose lang ya kuno, syempre hindi ka na ya fully vaccinated kung first dose lang. Yara da nga question nga gin-define ko na. Tapos may ato pag ito kagina pila ang capacity. Actually, Ma'am Rose, correct me if I'm right. If I'm right nang kung level 1, Ma'am Rose, 100% na, no?
Yes, ma'am.
Yes, oo, but we are doing the retrofitting kag ang mga posible pagid nga mga amon nga mga preparations diri to really observe the health protocols namon. Kaya
Yes.
kapag naman kumbel para tingog na lang.
Yes. Thank you very much, Ma'am Rose. Do you have any additional input sa kay Ma'am?
Nag-retrofitting kita, maskin mag-level 1 pa ta nga 100%, still ang protocol nga may ara kita nga physical distance of 1.5 meters. We really have to comply with that. That is why nga medyo mabulugod lay gani sa eskwelahan, no? Kaya nga aton nga classroom, makaigo lang na mga 24 lang ka estudyante because we will follow the 1.5 meters nga physical distance. But we are doing our best as a university to really comply with the IATF protocols.
Yes. Thank you very much. Yes.
Excited naman bala kami nga mag face to face para ma-meet naman ang mga gwapa-gwapo sang kabisi kabataan.
Yes. Yes, we have a question here. Although ma-answeran gini siya. Miss, good afternoon. Kung mag-apply kami sa PhilHealth, ano status ka membership namon? Voluntary lang, tas pila na amon membership fee. Yes, Miss Andrea.
Voluntary ina siya and wala siya membership fee. The only thing nga ginabayaran nyo is ang inyo na nga monthly contribution. So you are required for just 1 month lang mag-pay for voluntary members.
Yes, again, to Miss Christy, wala na siya membership fee but only the contribution or the monthly contribution lang ang ginabayaran natin. And another question here, ma'am, how about those kuno nga may medical condition and they are not allowed to be vaccinated? Ano ang pwede nila kunobrahon, ma'am?
Classes will not be disrupted even if we proceed with the limited face-to-face because ang hindi vaccinated, ma-proceed sila gyapon sa online class. So wala sang disruption. Kung hindi ka magpa-vaccine, kay tungod nga may mga comorbidities ka, although may mga comorbidities ang iban, gina-vaccine man, may medical certificate. Pero kung hindi gidya pwede, then ara ka lang gyapon sa online sa aton nga Aflex kay sige man na iya gyapon.
Yes, thank you. So it will be a blended type of learning. Mangyapon, there will be face-to-face classes as well as there will be online classes for those who are not qualified nga maka-join with the limited face-to-face nga classes.
Sir Mel, I'd like to add lang, for those bala na wala pa ka-member, no, they are encouraged to print na lang the PMRF sa amon website. So para pag abot din nila, yati may form na sila na fill out na kag may requirements na. And also for wala pa ka-member, kag ang ilabla concern is amo na kulbaan sila kay ma face-to-face classes basi magmasakit and everything. Pag pa-member nila gidya, halimbawa today mapa-member sila, mabayad sila 1 month, pwede na gidayon mausar ang PhilHealth if needed. Immediate availment gidya dayon. So that's the beauty of UHC. Pero kaluyan, hindi lang ta magmasakit.
Let's just pray gid safe lang gid kita. Para at least, mas okay na lang na yan secured kita and may na-prepare kita dan kasi sa wala kita kwaon, kung if something will really happen, hindi naman niya gusto pag pangunahan ang kalibutan. Pero amo na siya. Yes, I guess same questions lang man sila tanan. Again, there will be no membership fee but a monthly lang gid siya nga contribution which is 300 pesos. Kag there's a question kung kapila na gini nga sulit, is dapat may unod gid dapat ang PhilHealth kuno mag face to face. Kagina kapag gini nakita mga kapilaya gid gin balik-balik comment kung dapat may unod gid bala kuno ang PhilHealth mag face to face classes. Sige, ano miss. Dapat may unod gid siguro kay they are required to pay or they need to get a certificate of financial assessment from the LGU.
If the concern, sir, is amo na lang kung wala na sila ka-contribute, hindi na nila magamit dahil kung kinahanglan, magamit gid gihapon, i-update ta lang like a month or two, pwede gina siya gihapon
Yes, yes.
magbayaran.
Thank
But
you.
we are encouraging the members no to pay monthly gid to avoid penalties if ma-impose na ang penalties sa uli.
Okay.
Pero right now, wala pa man.
Yes, thank you very much. And there's a question here, of course. How about kuno ma'am, ang mga ma-OJT, do they need to get the PhilHealth kuno? Of course, kag dapat gid mas required gid siya ang ma-OJT since there will be a possibility that they will be deployed to their field. Di mas required na gid sila yan naton to get their own or to be registered sa aton nga PhilHealth.
Sir Mel, no, sa diri sa amon, magkadto diri magpa-member bala for amo na OJT purpose. We are telling gid the students, the members na mamangkot gid sila sa ma-employ bala sa ila if bayaran ang ila PhilHealth or hindi. Kay if bayaran, ti amo na ang employer na naay mabayad. Ang applyan gid nila ya is for employment, they need to secure lang barangay certification nga for employment ang purpose. No need na sila din mag-pay as long as may assurance sila nga bayaran sila sang ila employer. But if not, for OJT, ma-voluntary lang gid sila anay.
Yes, ma'am. And we have questions. Kadamo gyapon sa questions naton. Ma'am, what if kuno qualified siya for the face-to-face classes but by work siya and gusto niya mag-online class, is it possible? Is it a choice lang man gyapon, di ba ma'am, mag-limited face-to-face or once qualified sila dapat ma-face-to-face gid sila? Ano na ang pwede nga ano ma'am? Ma'am Janet or Ma'am Rose?
Mas namigid siya nga kung hindi siya excited magpa-school. Ang tanan-tanan do excited na yung magkilit-anay. Ay anyway, dumaano na yung tanan sa kamso nga magkilit-anay kay nag-university na. By choice man na siguro, pero I would advise nga kung qualified ka man lang, why not go back to school face to face kay there is really a big difference kung ang klase face to face kag virtual lang, no? Madugang nadagid si Ma'am Rose mo.
Yes, Ma'am Rose. Do you have any additional
Depende na kung ang imo nga mga schedule magsinanto masa schedule sang mga maestra sa kung pwede ka lang tanan online pero amo to gani mayo gid siya kay eventually gina-encourage siya tanan-tanan to have themselves vaccinated nga sa later on hindi lang ni siya limited nga face to face kundi in-person classes na gid although nga ang online learning is also here to stay, I guess, kahit inaglain na gid man ang sang kalibutan. But ang face-to-face, ta na gid naton, do gina-transition ta na post-pandemic. Pero kung gusto mo gid di ka na gid mag-atubang, ikaw lang da isa, choice mo man na siya actually. Pero gina-encourage gid nga mag-participate kung pan ka man lang, kung qualified.
Yes, ma'am. Okay, it's your choice, gid man at the end of the day. And yes, we have question here, miss. Pwede ma-beneficiary ka kuno sang grandparents na PhilHealth kay wala PhilHealth iya parents. Will it be considered?
Hindi sila ma-add as dependents ang grandparents. Ang only lang maka-add sa ila if wala sila parents are adoptive parents and foster parents.
So adoptive parents and foster parents and hindi na included ang grandparents. Hindi sila makategorize na iya-gyapan. Okay.
Unless may adoption papers, hindi pwede na.
Okay. So adoptive, it means adopted gid siya. I mean, there's an adoption paper gid nga kailangan i-present. Okay, thank you very much, miss.
For student,
Let's see if we still have questions from our students. Doka same lang man siya actually. Yes, I guess same lang man and they can still message us. Miss, is there any way nga pwede ka mo ma-message sa aton nga mga students since we cannot really cater them all of their questions this afternoon no? Because kada mo gid man sila concerns. Is there any means that they can message the PhilHealth or because in CAMSI they can message us through our official Facebook page if they have concerns and if matsiran lang man namon we can answer them. But as to the concerns that will be answered by PhilHealth, Miss, do you have any means, Facebook page or site nga pwede sila maka-message sa inyo with regards to their concerns and
Yes,
queries, Miss?
pwede gid sila sir ka message sa Facebook page or also katawag diri sa office.
Yes, may I ask na Miss sa Facebook page sa PhilHealth Bacolod?
PhilHealth Region 6 lang sir nga Facebook
Okay.
page.
So to all our
PhilHealth Region.
students who still have questions in mind, bother gid sa inyo, you may message Miss Andrea and the rest of the PhilHealth Bacolod sa PhilHealth Region 6. Okay?
Also you can call here man.
Or you may call them. Ara man na sila Facebook page ang ilang nga hotlines or the contact numbers. You may still call them. And in CAMSI naman nga for CAMSI concerns, you can message us in our official Facebook page, CAMSI Student Affairs and Services. So we will really try to answer all of your queries and concerns with regards to the requirements, to the limited face-to-face classes and other concerns pag relating to the school. Maasiran gid na siya namon kung magka-time with kami. We have a lot of works in concept. We are trying our best to answer all your questions, Gid. Yes, so before we proceed to the next part, ma'am, Miss Malihan, do you have final say to our students, Ma'am Janet and Ma'am Rose? Do we still have another gusto ta ano sa to ng mga students before we proceed? Miss Andrea, do you have final inputs or tanan naman na share naman?
Siguro sir ano na lang again ang PhilHealth nga registration form pwede gid nila ma-download online para at least sila magkadto diri ma-fill out na lang na nila and requirements are birth certificate or baptismal or voter certification or police clearance. And reiterate ko lang sir kay damo gid di cases no nga gakadto di and gusto gid nila yung may ID na sila even if hindi pa sila bala 21 years old we discourage gid no nga magpa-member na sila ya kay pwede gid sila pa malibre as dependent sa ila parents kay for just being practical bala na isa lang sa household ang nagabayad PhilHealth benefit. Halimbawa imo father go work i-add niya na kamutanan as dependent if qualified pa kamutanan and all of you can avail the same benefits as the member. Unlike yung mapilit gid sila para lang sa ID kag hindi naman nila ma-continue bayad so kanugon lang gid nga nagabayad man sila extra pa nga pwede pa na iya magamit pang balon, pang milk tea. Kay kagina may nakita ko din nag-comment nga excited sila sa face-to-face classes but wala sila pang bayad 300 pero may pang milk tea. And
Yes.
also encourage gid the students to be vaccinated na ako nagpa-vaccine gid ko kay excited mako mag face-to-face classes kami sa MPA dira sa CAMSI.
Yes. So, Miss, sorry, but there's last na lang gid ni siya nga question, Miss. What if kuno hindi is it okay kuno Miss kung madependent siya sa iya nga sister nga PhilHealth
Ay
or
hindi.
ma-consider siya?
Ang
Dapat parent lang gid.
ang ma-add lang gid sang member ya as dependent is their legal spouse, children 20 years old below, and parents 60 years old and above. But for those nga 60 years old and above na since mandated man nga tanan nga senior libre na, this is also for those nga ang ila lola, ila parents nga 60 na, pwede gid nila ma-inform na lang libre na magpa-member sa PhilHealth. Basta pag 60 na.
Okay. Sige, thank you very much. Again, you may inform your parents or lolas aging 60 years old and above. Pwede pagyapon sila ka-register sa PhilHealth kay libre na gid. Thanks to PhilHealth. Yes, again, Ma'am Janet and Ma'am Rose, do you have final inputs to our students before we proceed?
Ako lang yan, we have mga 3 months na lang to go before we open the doors of CAMSI for the limited face of CAMSU for the limited face-to-face classes. So hindi na ta mag-waste ang time. Pa-register na kita sa PhilHealth. After all, libre man, do halos na nahatag na no, sa gobyerno. Though we have no reason nga hindi kita magpa-register, nga mag-avail sang sinay nga mga benefits. And of course, have yourselves vaccinated para we will see each other here inside the portal of CAMSU.
Yes. Thank you very much, Ma'am Rose. Miss Andrea, pwede pa ko last na lang gid nga question, Miss Kid may nag-message, pagit mapahabol, pagit saya, Miss. This is a message from the Fortune Town campus. Good afternoon. Pwede ka as if ever na expired na be ang PhilHealth kay imo parents, then manog 21 naman this year. Pwede nakapa-register individual.
Ah,
Expired na kung ang PhilHealth ni parents, Miss.
pwede man sir, but we are encouraging na lang nga ang iya na lang ka parents anay ang i-continue bayad, especially if may mga utod pa siya para tanan na sila. Pag turn niya 21, that's the time nga mapa-member na lang gid siya. Pa-add lang siya anay as dependent sa iya parents, bali fill out ka parents niyang i-process, ipa-add siya as dependent. Amula na anay i-continue samtang wala pa siya nag-21.
So, okay lang na siya. Miss, kung na-expire na siya, pwede lang siya do ka reactivate or ano na siyang
Yes, so
the term
i-update niya lang
that's
sir to voluntary
update.
or amo na mapa-assess sila sa LGU. Damo na sila options.
Okay. Yes, okay. Thank you very much, Miss. Again, to all of your concerns, queries, no, agabother gid sa inyo subong, you may message us in our Facebook page or you may message as well, Miss Andrea and the rest of the team sa PhilHealth Bacolod in their official Facebook page, man, PhilHealth Region 6. So if you have concerns, message them or you may call them. Their contact numbers are man sila page, are there in their page. Pwede nyo man gito ma-check. So talaga, wala gin magkakaubusan sa mga Facebook. Yes, again, thank you very much, Miss Chid, Andrea Bimahilihan, for sharing your time and expertise to our students. I hope na-answer tagid and na-address tagid ang mga concerns sa aton students. But rest assured to our students, this is just the first part of the series of orientation that we will be conducting with regards to the requirement that we will be having in preparation for the limited face-to-face classes. Indeed, magkakulban, although 3 months lang, rest assured that we will do our best, Gid, to provide you the services that you need and ma-address kita ng natin nga concerns kag makit anay kita sa sunod nga academic year for the limited face-to-face classes. Let's claim it na lang, Gid. And now, let me take this opportunity to express our gratitude in this momentous event by giving the certificate of appreciation to our speaker. Let me read to you the certificate of appreciation. Carlos Hilado Memorial State College awards this certificate of appreciation to Ms. Chid Andrea B. Malihan in recognition of invaluable service extended to the school as resource speaker during virtual orientation on Republic Act 1123 or the Universal Healthcare Act, given this 20th day of April 2022 at Carlos Hilado Memorial State College, now University Talisay City, Negros Occidental. Signed by Dr. Janet P. Espinosa, the Director for Student Affairs and Services, Dr. J.B. Estrellas, the Vice President for Academic Affairs, and our SUC President 3, Dr. Norberto P. Mangulabnan. Again, thank you very much, Ms. Chid Andrea Malihan, for sharing, for spending your time with us. Damo kami na learn with regards to the Republic Act 11-22-3. Thank you, Gid. And of course, to our participants no, na nag-participate sa aton. I hope to all our Kamshuans, I hope that you have learned a lot from this orientation this afternoon. And at this moment, we would like to remind everyone as well to fill out the evaluation forms. Again, the evaluation forms that will be part of your attendance this afternoon. Evaluation forms are already posted in our caption and comment section. There are 2 evaluation forms, one from the PhilHealth Bacolod and one from CAMSI itself. Yet, we have two evaluation forms ara lang sa ato nga caption and sa ato nga comment section. Okay? Fill out na lang para it will be part of your attendance this afternoon. So before we finally end this session, let us hear a word of thanks to our proactive Vice President for Administration and Finance. Let us all welcome Mrs. Rosalinda S. Tuvilla. Let's give her a warm round of applause, please.
Good afternoon to our dear students of Carlos Hilado Memorial State University. It is a pleasure having you with us this afternoon for the orientation of the Universal Healthcare Act. And we are thankful to Ms. Malihan, our resource person today. We are also thankful to Ma'am Janet and her staff for facilitating this orientation. The university has been very busy with the ongoing retrofitting of our classrooms and laboratories in preparation for the limited face-to-face classes effective August 2022. And so this afternoon's undertaking is part of the many orientations that we will be conducting to prepare our students, our dear students, for the holding of the limited face-to-face classes. So, dali na, magpa-register na kita sa PhilHealth, magpa-vaccine na kita kay nahidlaw na kami sa inyo nga magkilit anay kita diri liwat sa Carlos Hilado Memorial State University. Good afternoon, kamo lang ang sakalam. Thank you very much.
So thank you very much, Ma'am Rose, for closing our program with your words of wisdom. Kamu lang gituot ang sakalam. And of course, a big thanks man to all our administrators. Kamu lang gid man tuod, Ma'am, ang sakalam, because with your wisdom and with your effort, now our state college becomes a state university. Kudos gid to all our administrators, faculty, staff of Carlos Hilado Memorial State University. Once again, on behalf of the Office for Student Affairs and Services of Carlos Hilado Memorial State University, a big thanks to all of you who participated in this afternoon's orientation on the Universal Healthcare Act. Let us give ourselves our loudest virtual applause. And to end this orientation, let us sing with pride and honor our Kamsi hymn by our Kamsi Alumni Choir.
Always from stars we splendid hope, with hope reside as it does fall. Tears on the anvil stole the hymn to lead the song. Come see dear, come see the Lord, hope and joy. Science, technology, deploy to use it further, burning still. Don't quench the thirst for knowledge and skill. Oh, hail, we pledge our loyalty, and all our thoughts for the glory be to the skies, the land, the noble blue. Come see to thee will be true. Oh, hail, when pioneering days will end, and success or stress will sure portend. The song will ring loudly through the skies to thank the great power on high.
Yay!